So teenagers, their lives are, hormones and things like that is very messy.
Yes.
So, giving them consistency and something that is always there at constant is actually very reassuring for them also.
Okay.
Parents of young children, I would say, start the emotional literacy from birth. Right? So be respectful of the child's boundaries, no means no. Humans, we are innate social beings, so we do need that face-to-face contact, and we do need to know how to talk to people, we need to know how to relate to people. And if our teenagers are not able to do that, then when they grow up, very difficult. Children learn how to manage their emotions from their parents, right? If the teenager never had that experience from their parents, means actually the teenager is also crippled in how they manage emotions.
Okay.
So therapy helps them to learn how to manage emotions adequately, but parents also need to learn how to do that.
True. Welcome to the show. I'm Dr. Chai Ling, and today we're diving into a topic that is close to many parents, educators, and anyone who cares about the next generation. Our episode is entitled, Inside the Minds of Today's Teens, What They're Not Telling You. Adolescence has always been challenging, but today's teens face unprecedented struggles with mental health driven by pressures from social media, academic stress, an increasingly uncertain world. Joining me today is Sook Fern, a clinical psychologist with over a decade of experience helping teens navigate serious challenges like anxiety, depression, self-harm, and even suicidal thoughts. She's here to shed light on what teens are really thinking and feeling, but might be too scared or unable to say out loud. This is a conversation about understanding, supporting, and ultimately helping teens. So let's get started. So, I've been hearing so much about mental wellness for teenagers and teen suicides. Is this something that you see in your practice? Now,
quite a number. Typically, we would get referrals for like low mood, occasionally self-harm. Suicidality is a little bit less. That one is a little bit in the more acute settings like hospitals. I used to work in a hospital.
Yes.
So we would see quite a number of that as well, sometimes even in the inpatient settings, because the parents will bring them in for suicidality because they're not safe. So then the doctors will have done psychiatric evaluation, and then they deem the child or teenager unfit to go home, so they need to be warded to stabilize, and then so we'll be called to see them.
So what are the most common mental wellness or mental health challenges that teenagers face today?
Nowadays, depression, anxiety. There's this thing we call psychosomatization as well. So this is like, tummy aches, headaches, chest pains, but there are no organic causes. So there's a psychological component behind it. So it's usually anxiety that's driving.
That's so interesting. So how old would they be to have all these symptoms, you think?
Primary schoolers can have that. Secondary school, it can start from primary school.
I remember when my son was in primary 3, he always had stomach ache before exam. So that actually is a sign of anxiety. But we always scolded him and says, "Oh, you're just a naughty boy. You're trying to." So actually, it was like you say, psychosomatization.
Yeah. And sometimes they don't know how to say it, you see. So the body kind of manifests the stress with, like a physical kind of symptom. So like chest pain is very concerning, right? So you always bring to go and see doctor.
Yeah.
So a lot of our patients will have many, many rounds of, medical clearances, a lot of tests, a lot of scans and things like that.
See.
Always nothing.
Okay.
So then they'll be like, okay, let's refer to the psychologist.
All right.
Because they suspect there may be a psychological component to it.
How do you actually get these kids to open up to you? Because I understand, teenagers can be quite close, very wary about adults. That's why I find it hard to talk to my teens too sometimes.
It's surprisingly not that difficult, because I think in our clinic, the setting is a little bit different because we're professionals.
Yeah.
They know that we are someone that they can actually talk to. Therapist patient confidentiality. So there are certain things that we cannot actually share with the parents unless we get their permission. But of course, we always tell them if there are safety concerns, then that one, no choice, we have to break confidentiality to keep them safe.
Okay, so even a young child, say somebody 10 years old, they will see you alone without the parents?
Yeah.
I see. And how do you get them to open up?
I mean, usually when we first get them in, it's like rapport building. So then we would, talk to them, play games with them. We don't usually dive right into the topic at hand. So I usually get them a little bit more comfortable first. Younger children would be like play games, I have some toys in my room, some games. And then the older teens will talk about other things because I always tell them, as a teenager, there are like kind of like few aspects to your life, right? So there's like home, there's like school, there's like friends, there's your family, yourself and all that. So that I just kind of want to find out about them, and then you kind of get a bit of an idea about who they are, what are certain factors that might be affecting the problem that that they have. Then slowly then we'll ask them, okay, if you were to continue coming in, for example, what would you like to work on? Then they're usually quite open.
Really? Okay. So I mean, it sounds like you speak to a lot of teenagers. What's actually going on in their minds these days? What problems affect them the most? Is it school or?
School is a big one. So grades are always like
in Singapore
at the forefront. Least, right? So grades, exams, friends.
Yeah. And we are talking about what is the most common age for these to manifest? Are we talking about late teens?
Early teens.
Early teens?
Early teens. Or even sometimes like upper primary schoolers.
Really? Because do you think it's getting younger because everybody's maturing earlier?
Correct. So like say we hear cases of girls getting their periods earlier and earlier. Right? I think, I mean, in my time, I think it was about 12, 13. But I think right now it's not uncommon to hear of girls like 10, 11, having their first menses. But if you kind of think about it, managing these things, actually you need a certain level of cognitive functioning for it. And sometimes the 10, 11-year-olds might not actually be ready to handle it.
Okay. So for, you're saying the most common problem is grades and then perhaps friends. Do you think social media actually plays a part in making this problem worse or better?
There's always a pro and a con to it. So I don't say necessarily that it is to a detriment or it's a benefit. I think it's how they use it, how much they use it, how much they actually pin their self-worth to social media. I mean, for example, you will have teenagers who are chasing, the amount of views or the amount of likes or the amount of followers. Then, of course, these ones are more vulnerable to getting into trouble compared to those are just like, okay, social media is just like one part of my life. But I have many other parts like the sports part, the school part, the family part.
I mean, I don't know if you remember being a teen yourself, but I remember when I was in primary school, I don't think I had that much pressure because I couldn't really compare with the people around me beyond my classmates, right?
Correct.
I think now you can really, on social media, see so many people, and I think parents' expectations are also a bit higher, you think?
I think maybe not say higher, but I think it can be influenced by what they see on social media. Social media, I mean, as much as possible, we want to paint, the most positive view of things. So even if a child or a teenager is going through something that's not going so well for them, but they'll post it that, I'm not having such a good time, but, but they kind of frame it in such a nice way that it doesn't kind of maybe reflect the extent to which they're really, really struggling.
Because I mean, if you open up social media now, you would think that all the teens are very happy, looking very
Not
good.
necessarily. Not necessarily. You need to know what to look for.
I see.
Yeah, so of course there are always, I mean, yes, there's the very preppy, happy posts, but there's always the ones, if you know where to look for it, there are always, you can find posts where teenagers are struggling mentally, I have depression, I have anxiety, I have an eating disorder, I have BPD, I have, all these things. And then somehow other people will be like, oh, I also have this.
I see.
Then it's either they find solace in each other, like, hey, we're going through this together, we can do it. Or the bad part is that they may start copying each other's behaviors.
Yes.
Yeah.
So actually, being online is not a bad thing, right? Because you can actually find your own group, you think?
Yeah.
You can actually help. Okay. I mean, one interesting thing I heard from my friend the other day was she actually said that when she was not feeling good, she asked ChatGPT what to do. So do you get teens doing that, like relying on AI?
I actually had one recently who was telling me, what did she tell me? I can't remember. But then she was actually saying she had some problem. And then she said, I went to ask ChatGPT what to do.
Yeah.
And it kind of gave me this like, this is what you can try. And she goes, oh, okay. Actually, that's not too bad. I'll try it. Yeah.
So it does make some sense. At least they get some sort of advice and solace.
And sometimes it's like, because, I mean, I've used ChatGPT before,
Yes.
so sometimes when you like talk to it,
Yeah.
it almost feels as if there is someone responding to you, because ChatGPT AI, right? So they kind of tailor their response to what you actually need. And sometimes they are quite accurate.
Yes.
So then it almost feels, to the teenager, it might feel like, okay, this thing gets me.
Yeah. So, for all these teenagers, I presume they are brought in by their parents. So how?
No, not always.
No. Do they come in themselves?
Sometimes they will tell their parents, I want to see someone.
Okay.
I've had a couple of cases where either for like psychological assessments or for therapy, and then their parents are like, why do you have to see the person? Then they were like, I remember one where she told her parents that she's neurodivergent. So she was convinced that she had ADHD.
Okay.
Because they are exposed to a lot of things online now.
Yes.
So they can go and see ADHD symptoms. Oh, I have this. I have ADHD.
Yes.
So then I tell parents, okay, I have ADHD. You need to get me assessed.
Okay.
So when I spoke to the parents first, I usually see parents first before the child, right? So when I spoke to the parents, it became very clear to me that it wasn't just purely ADHD. Yes, there are symptoms there, but then it seemed like her mood was also quite low. So then when I dug a little bit deeper with her parents, I think she was actually depressed rather than ADHD. So I told her parents, actually, please go and get some help for her in terms of therapy, maybe see a psychiatrist first.
Okay.
And if the ADHD symptoms still continue to manifest, then we can consider an assessment.
Okay.
Yeah.
So for your practice, what do you actually do for the teenagers?
Different forms of therapy depending on what they need.
Okay.
So a lot of times if they come in for things like school refusal, for example, then we might kind of explore the reasons behind the school refusal and then work on a plan. Usually we have to work with a lot of stakeholders. So like the schools, the teachers, principals, parents, maybe psychiatrists, or anyone else that they're seeing.
Right.
So we'll work with the school, for example, to integrate them back to school. So maybe like half days first, a couple times a week, then slowly, 5 full half days, then slowly move to full days, something like that.
Yeah.
And then after in school, we also need someone to kind of like support them. So usually the school counselor.
I see.
Yeah. So then it's like, instead of going to class, it will be like, okay, they'll go to the counselor's office first because they are in school, right? Just to get them into school first. Then slowly introduce them into the classroom. So then it's
you
like
see a lot of depressed, low mood or teens battling with depression, right?
Yes, and comorbid with other stuff.
Yes,
okay, so
that's
depression, anxiety kind of goes together.
Yeah, and so what are some of the comorbidities like?
With depression, anxiety, OCD,
maybe some eating
disorders, then kind of unstable personality traits.
Oh, really?
Self-harm, suicidality, they kind of go hand in hand with depression as well.
Then is there a difference between boys and girls? Who do you see more of, and what do each gender tend to have more?
I tend to see more girls.
Okay.
But I don't know, is it because of just, girls have more tendency to seek help?
That's true.
Boys, I mean, I think there's still a little bit, we're better at it, but I think there's still a little bit of a stigma attached to seeking mental help, in general. So, and more so for boys. But they do come. For boys, the symptoms are usually more like irritability, anger. Yeah.
I see.
Sometimes there's a bit of social withdrawal.
Okay.
But for girls, it's more the traditional kind of symptoms that we know what depression is, the crying spells, the social withdrawal, poor self-care could go across both boys and girls also.
Okay. What really interests me is, are there actually a trigger for all these depressive episodes? Like maybe a breakup, or sometimes is there no trigger?
Sometimes there's no trigger, sometimes there is a trigger. Depression, we do know that there's a slight hereditary component. So sometimes when you kind of check with the families, any family history and stuff like that, sometimes it could be like an aunt or a grandparent or even a parent with depression or anxiety as well. Then it kind of, the teen is more vulnerable to getting it. Doesn't mean they'll get it. But then after that, I always say it's like you have to add biology and then you add the social part as well, right?
Yeah.
So something in the environment will set the depressive episode off. So it could be a breakup, it could be a school change,
maybe,
right? Because everyone goes from like P6 to Sec 1, right? Or friendship problem, argument, that sort of thing. Yeah.
I mean, I have two teenagers. They're now a bit older. And I'm just wondering, what are the warning signs we as parents should look for, to maybe help identify all these issues before they become even serious?
I mean, I think one thing we need to know is that teenagers, they have their mood swings, right? I think we know that. But typical mood swings that are not related to depression, they don't last very long. So they kind of, up, down. One day I don't want to talk to you, next day is mommy, I love you, sort of thing. But I think depression is a little bit more pervasive.
Okay.
So it's more like social withdrawal, don't really want to eat, don't really want to hang out with the family anymore, whole day lock themselves in a room.
Okay.
They may be posting like, cryptic dark messages on social media.
Right.
So that's where sometimes friends are also important in alerting parents, because sometimes if they just post, but there are no other signs, especially for those really, really high achieving, very high functioning teenagers, they don't usually show a lot of signs.
Okay.
So their friends are sometimes a good source of alerting parents, like, hey, auntie, uncle, I think who something they posted this yesterday, but they post on their private account, so
right.
Yeah.
Do you think communication between parents and the teens is vital? Because sometimes it's so difficult to talk to them.
Correct. Absolutely vital.
Yeah.
I think it's a lot of teens will tell me, they don't dare to tell mommy and daddy about what's going on. But then, but you feel so comfortable telling me, yeah, but you're not my mommy and daddy. Yeah, but sometimes when you kind of explore them a little bit more, sometimes it's also the emotional literacy, the emotional setup at home may not be so supportive of a child being, for a teen to be open with their parents.
I see. So do you counsel the parents and give them tips on how to communicate better with your child?
Absolutely.
Can you give me some tips so that I can communicate better with mine?
Well, I mean, for parents, I think things like very practical things, like, for example, family meals.
Okay.
Right, family meals have been scientifically proven, to help build a teen's resilience, to help improve their mental well-being, because it's a common time where everyone gets together, everyone gets to share about their day, everyone discharges.
Right.
So it's not like the teenager doesn't feel targeted, like, okay, why am I the only one talking? But it's mommy talking, it's daddy talking, it's姐姐or 弟弟妹妹 talking also. So it's not just me, and everyone can share, what their struggles were, their triumphs of the day, that sort of thing. So the parents can also kind of know, hey, okay, this is what's happening in my child's day today, or my friend said this, I got so angry. Oh, okay, that must have been so bad for you. But then the teen also knows that, okay, at least mommy and daddy are listening. Right? There's a time that I can download.
Exactly.
Yeah.
Actually, that was so important. I remember when I was younger, my dad always says, at 6 o'clock, everybody must come down and have dinner together. It doesn't matter what you're doing.
Correct.
And nowadays, I think it's not so strict. And I also find that sometimes when we have meals, everybody's on their own devices, not just the kids,
correct. Parents
adults as well.
Yeah. I think that's a problem we have. I mean, you can go to restaurants, you will see, right?
Yeah,
I mean, I'm guilty of it sometimes also. But yeah, I mean, for me, at meal times, I do try to make a conscious decision to put my phone down, so that I can actually pay attention to my child. For me, I do tell parents a practical thing to do would be to try and ensure that, you at least try to have dinner together as a family.
One time where you can sit together.
Correct.
Yeah.
If not daytime, I mean weekdays if it's difficult because everyone has different schedules, right? Maybe on the weekends, like a Saturday or a Sunday, either have lunch or have dinner together. So there's always that check-in point that teenagers can look forward to.
And it doesn't have to be talking about anything earth-shattering, but just having that regular meetup gives them opportunity to share one day if they need to.
Correct. And it's also constant, right?
Yeah.
So teenagers, their lives are, hormones and things like that, it's very messy.
Yes.
So, giving them consistency and something that is always there at constant is actually very reassuring for them also.
Okay. What other tips are there? I think family meals.
I think sometimes one-on-one, sometimes, like daddy-daughter dates, or, spending, like sometimes, I remember one of my ex-colleagues used to tell me the therapeutic gain was not actually the child coming to session. It was actually the parent ferrying the child to session, because the relationship had been so strained for such a long time. So the teen was clearly having mental health issues. But then the parent would actually drive the teenager to session, because it's quite a bit of a drive. And during the drive, because regularly, they started talking.
I see.
And then from there, the parent actually started to find, this is all happening.
Yeah.
this was what they were struggling with. This is who they're hanging out with. This one not so good. Oh, this maybe you hang out with this
So
person.
just giving your child that one-on-one
Correct.
time, be it with one child or, and then that gives an opportunity for them to be comfortable. I never actually thought of that because, you're right. I mean, sometimes in the old days, don't our parents sometimes ferry us to school or something, right? Yeah.
Correct.
So then that gives us time or to CCA, yeah. Is there anything else we can do as parents to ensure that, we can improve the communication? Is there like certain words we should never use that we are totally using now? Or?
A lot. I mean, one of the things is usually sometimes when they come to me, their kids are a little bit older already. But for parents of young children, I would say, start the emotional literacy from birth, right? So be respectful of the child's boundaries, no means no, if you've done something wrong, it's okay to apologize to your child.
Okay.
Good manners, setting routines, things like routines and things like that. Children and teenagers also need it. So it's something we continue as well.
Yeah.
So having little rituals like bedtime routine and things like that. I remember my mother as a teenager, I didn't find it cringe, but maybe right now teenagers will find it very cringe, but she will always have this bedtime ritual with me before I fell asleep. Even when I was like, very much older already. Yeah, so she'll have this 3 kisses, 3 here, 3 and 3 here.
So
and I still remember it to this day.
Yeah.
So then it's like every night she will do it.
Right.
Even if I'm upset or if I'm angry or whatever, she will do it. So it's just little things like that that grounds the child.
Yes, I agree. I mean, what do you think of shouting and raising your voice? Because, sometimes parents think that they have to rule with an iron fist, so then they shout. But does that actually shut down communication?
It
child
hurts communication because I think when you shout and when you raise your voice at children or teenagers, I mean, we've all done it, right? Because we're pushed to the limit and we're human. But then, as much as possible, no need to be perfect, right? So I think as long as like 70%, 80%, the communication is respectful. Yes, and you catch yourself, you apologize after.
Yes.
Like, I'm sorry for raising my voice just now. I was really concerned. But sometimes no choice. I mean, if dangerous, for example, the kids running across the road, of course you have to shout, right?
Okay.
But usually when they're talking about difficult topics, for example, I'll tell parents, I know it's really hard, but you really need to try and stay calm and listen.
Okay.
Right? Because yes, we want our point to go across to the child.
Yeah.
But if the child does not feel like you are listening, they're not going to listen to you also.
Okay.
Yeah. So the very zen, very calm. I tell parents, okay, you need to take 10 deep breaths first. You go and take 10 deep breaths first.
Because parents do set the example for the child. If you want the child to be calm, then
correct.
Yeah, okay.
And I mean, if you want the child to come to you for something, then you need to show them that you're emotionally available. So if the child comes to you and then you get really upset in reaction to what the child is telling you, then of course the child's going to think, this one I cannot talk to this person.
Yes.
I say only they get triggered already, then problem not solved, problem's worse.
Yeah.
Yeah.
Okay. So that's where they start keeping things to themselves.
Correct. Then they start hiding.
What do you think of caning? I don't know if people still cane, but I remember
yes, they
when I was younger, that's what parents usually threaten the kids with. Is that detrimental or is that something allowed? Is there boundaries we can draw?
I mean, caning is, as far as I know, caning is not illegal in Singapore yet. But it is in certain countries.
Okay.
As psychologists, we don't recommend caning at all. Because caning actually registers as trauma in the brain.
Okay.
And trauma will actually alter the brain in such a way that it actually sets the child up for poorer emotional dysregulation, poorer communication, poorer grades, poorer mental health. So it's almost like a vicious cycle. It's like you cane the child, then they have this host of problems, and then you get angry at this host of problems, and then you punish the child even more.
Oh my God.
So it's a
but sometimes you actually see that,
Yes.
Yeah.
Yes.
Well, now that I have you here, there are actually a few interesting scenarios I wanted to run through you and I. It came from all my patients. One of my patients was telling me that she thought the child was acting a little strangely, was a bit depressed. So she went, and I think the child was about 16 years old, and read through all her WhatsApp messages and found that she was seeing a guy. Okay. Now, what do you think of parents who do that? Is there boundaries that we should keep, like never read their WhatsApp? Or is it okay for us to go and read all the messages? Because I don't know, I'll be very sure if my mom read my WhatsApp.
I think there needs to be some boundaries around it. I think if, in typical kind of normal everyday cases, I think it's okay, not, I mean, you do need to allow your child to have some privacy also.
Yeah.
The only things I tell parents, like for example, if I'm working with children eating disorders, for example, or children with depression, or children who are self-harming, if they are going on the internet and making friends with others who are also doing the same things, and they are copying these
I
behaviors,
see.
then I'll tell parents, okay, then there needs to be a limit,
Okay.
right? Maybe the teenager's not ready to hang out with these people for now until they are more stable.
I see. So giving some amount of trust
Yeah.
by monitoring them, I think that's
Correct.
difficult to strike a balance, right? How much trust do we give them? And then, if we don't trust them, then, they don't open up to us.
But see, that goes back to that open communication. So the foundation that you set from a young age, right? If the child can always come to you for no matter how small, like my friend pushed me today in preschool, for example, but you listen. So the child will know that, okay, my voice does matter.
Yeah.
Right? So then, no matter what, they'll come to you. Who their friends are, good or bad, they'll tell you what the teacher say today, what the discipline master say today.
So not to judge them too harshly.
Correct. As long as
tell you.
listen, they know they can always come to you.
I see.
So then it kind of mitigates, when in their teen years, when there's something big, they still feel safe coming to you.
So even if your teen comes and tell you something really shocking, you should actually try to stay calm.
Yes.
And not go, oh my God, I can't believe I did that. Because that'll be the no-no, right?
All right, so I tell parents, you respond, you don't react.
Okay.
That's the difference.
That's actually very good, to respond and don't react, because I think all of us react.
Yes.
Yeah.
Yes, correct. If the child goes, of the school nurse, tells, your daughter has been cutting herself.
Yeah.
Then the parent goes, why like that? Not like that.
Yeah, then the reaction shuts the kids
Correct.
down.
The kid's like, yeah, that was not what I was looking for. Mom to be a bit more supportive, but she react until like that. The next time I better not tell her. I hide it better.
Yeah.
Yeah.
Yeah. Because, I do actually see some kids that has been self-harming, that cutting themselves, and the parents bring them to see me to treat or laser away the scars. So, do you actually see a lot of girls that actually do that? And is that serious? Are they just attention seeking? Is this a prelude to something more serious?
I mean, I have a little bit of trouble with the word attention, the phrase attention seeking. Okay. So I usually tell parents, if the child is doing this, behavior is communication. So what is the behavior telling you? Right? It's I need help, or I need support, or something's not right. So rather than kind of just focusing on maybe punishing the child for that cutting herself, for example, really need to find out, okay, what's actually going on? It's like an iceberg, right? So the top above the water, you will see the cutting.
Okay.
But underneath, the 90% of the iceberg that we don't see, what's happening in the 90%? Because what's happening in 90% is driving the 10% on top.
Okay.
Right? So it can be depression, it can be friendship problem, can be worry about grades or falling behind in school, all that sort of thing.
Okay.
Yeah.
Yeah. Because, I do have a lot of parents who tell me that, they actually see all these little cuts on their daughter's hands and they are at a loss of what to even do, Do they straight away bring to see a psychiatrist, or do they actually watch and see, try to talk to the girl?
As parents, I think try to talk to the girl first. If she's willing to open up. I mean, generally children who self-harm, I would say a large majority of them do need professional help in learning more suitable, healthier coping strategies. Right. I will tell my patients, we don't recommend you cutting yourself. Because honestly, there's a limit. You can cut. There's a limit, right? You're going to run out of space.
Yeah.
Or you're going to get in trouble because you cut so deep. You nick an artery or something like that. And I have seen cases where they need surgery. They've cut the tendon, the wrist tendon.
But amongst all the people who cut themselves, actually, how many really want to die?
Cutting is not usually a suicidal kind of behavior.
So it's more of release something.
Yeah. It's like they feel emotional pain, then it kind of transfers to the physical pain. And I think I remember one study that kind of quoted, they were saying that the effect of cutting is actually very similar to you taking antidepressants.
Oh, really?
Yeah.
So they actually do release.
Correct.
Okay.
But it's a self-perpetuating cycle, right? Because you like that, then you feel better, of course you want to do it again.
Okay.
Yeah.
Is this a little bit like those religious sects where they actually self-flagellate? So then there is a little bit of relief maybe?
Correct.
Okay.
But then if you don't learn an appropriate coping strategy, then you're going to keep doing it and it's not healthy in the long run.
I get it.
So that's why I always tell my patients, right? You're doing it now. Yes, it is a way of coping, right? But in the long run, you cannot do it.
Okay.
You can't keep up doing this. Eventually, one day you're going to get into trouble or you're going to get tetanus, or something like that. Yeah.
So what kind of self-coping strategies do you suggest to them?
Okay, I always tell them, but this one is very hard for Singapore. Sleep is very important. Okay, adequate exercise. Proper nutrition, right? Don't skip your meals.
Actually,
you're
great
advice, right?
This is just so great.
It's very basic
advice.
It's very basic.
I thought you were going to give something really difficult, like meditate for 3 hours. Sleep.
Yes.
Nutrition as in what kind of, is there any particular?
Balanced meals lah.
Okay.
Balanced meals, appropriate amount of carbohydrates, proteins, veggies, dairy, and then fiber.
Yeah.
Right? And then adequate hydration, exercise, hanging out with your friends.
Yeah.
Good ones lah.
Yeah.
Good influence.
Because sunlight has been shown to
And
improve.
sunlight, yes, exactly. So vitamin D, social, hanging out with your family.
Yeah.
And then stress management, simple breathing exercises, which you can find online.
Okay.
Yeah, journaling.
And what happens if they feel an urge to cut themselves? Is that something they can do to, overcome this? Be it taking deep breaths, I don't know, visualization, is that something?
So it depends on how strong the urge is, right? So for those that are really strong, I'll tell my patients to do things, those a bit more sensorial, like, go and drink really cold water.
Okay.
Or go and splash cold water, on your face. Okay, or take like a really cold towel and just, put it there.
Okay.
Or whole ice cubes.
And that would relieve that urge to...
Not say relieve the urge, but it kind of brings down the urge a little bit so that the rational part of the brain gets switched on.
Okay, that's interesting.
Then they can kind of decide, okay, not a wise thing to do, should do something else instead.
Okay.
Yeah, it's just to ride the wave, as I call it. Because when the wave of the intensity of the feeling is really high, at its peak, that's when you actually want to do something.
Okay.
Right? But as long as you kind of get past that peak,
yeah.
And I tell my patients, the feelings actually don't last. Okay. Right? There's no way you will feel a 10 out of 10 happiness for the entire day. Your body just doesn't work that way.
Yes.
So same with sadness, same with anger, the feeling will pass. So even if you sit on your hands and you do nothing, I tell them, it might be for 2 hours, but 2 hours time, the urge will be gone.
So to observe and everything. Years ago when I was in London and I was going through a tough phase, I think somebody actually taught me there was some tapping technique. I completely have forgotten it now. And I remember I was taught how to tap in certain ways, and that sort of like released the surge of, negative emotions that came on. Is that something you also teach?
Yeah, actually, I recently just taught someone what we call bilateral tapping.
Okay.
So what happens is you actually just tap. It can be your shoulder or your knee or your elbow. So basically one with two sides, right?
Okay.
You just tap it at 1 second intervals.
Okay.
Yeah. And so what happens is that this activates, this side of the brain, and this activates this side of the brain with the input, right?
Okay.
So because when a teen is dysregulated, usually only one side of the brain, the emotional part is flaring, but the logical side is shut off.
I see.
What you want to do is to make sure that both sides of the brain are on so that the teen can make the wisest decision for themselves as to what to do.
Okay.
And to get them to focus on just the tapping sensation.
Okay.
And there is some science to it. I can't explain the science to it, but it does work.
It does work.
I do it for young children as well. I do it for my kid also when he's really, really upset.
Okay. So when he's really upset, you would
I'll
tap
hold
him on
him,
the
then I'll tap him on the knee.
Okay.
Yeah. Sometimes he'll push my hand away. And I go, no, mommy.
But does that actually
then you can see after a while he will come.
Okay, that's amazing. Does that work on adults?
Yes.
Oh, okay.
All ages.
Puppies, dogs?
That one I don't know. You can try.
Okay, so actually just tapping that kind of like reactivates and recenters the correct part of the brain, and then they go, I think that makes a lot of sense. So are there things that they shouldn't do? We've gone through things that they should do or things to avoid. What do you think of online gaming? Because my teen boy actually spends a lot of time online gaming, and I wondered if that would contribute to...
you need to see the function of the gaming, right? If their gaming is getting in the way of getting your homework done or hanging out with their friends, but sometimes they tell me, but I hang out with my friends on the game.
Exactly.
Then I go, okay, slippery slope. But,
yes,
as a person, we also need face-to-face contact, right? So sometimes you may find that because they use so much devices, they're always online and things like that, sometimes we find that, their social skills are not on par.
Yeah.
Because they spend so much time online and not enough like face-to-face.
Yeah.
Because as humans, we are innate social beings, so we do need that face-to-face contact, and we do need to know how to talk to people, we need to know how to relate to people. And if our teenagers are not able to do that, then when they grow up, very difficult.
Yes. I think like physical touch is one thing that is getting less and less between teenagers and the parents because of so much online interaction and not real contact, So one thing I forced my son to do is to give me a certain number of hugs a day, and he always gives it grudgingly. But I just felt,
But he gives it and he will still give.
He will still give. But I think you can text that I love you, but it isn't quite the same. And I think it was like your mom forcing that 3 kisses on you.
Of course, I wanted
you wanted it. Yeah, so, I think that is something that maybe is kind of missing, right? Yeah.
I mean, a lot of parents will tell me all this, this one, they don't want to hug one.
Yes.
Every time how they cringe, don't want, sort of thing.
Yeah.
So, I mean, it's like part of it maybe is they become a teenager already, or they're like, hugging's for babies, that sort of thing.
Yeah.
But I think sometimes there is a function to skin.
Yeah.
Right? I mean, we know that when babies are born, nowadays they'll put the baby on the mother's chest, immediately after delivery.
Yeah.
So there's a reason, right? Is to kind of like help kickstart the baby's, systems, calm the baby's heart rate down and all that. So it's the same for children, it's the same for teenagers, even for adults. I mean, sometimes when we go in for a hug with our partners, for example, or our parents or our children, you do get that rush of like the feel-good kind of hormones. So
yes,
I would expect that teenagers would have the same thing. It's just that they're like, but maybe do it in like, I don't know, somewhere private that they're like, okay, never mind, my friends don't see.
Don't see that sort of thing. Yeah. So, now coming to the harder part of some teens, is not just cutting. I think they actually have suicidal ideas, or they actually attempt to really harm themselves, be it overdose or, So for those teens, what can we do? What can you do? What can society do?
Those teens will need professional help, definitely. And usually, I would tell parents as well that there may be certain things that you need to do at home to facilitate their recovery.
Okay.
So there may be times where, if the teenager has always been locking themselves in a room, and then they somehow manage to smuggle their medication into the room. And then, I had one I remember where she actually managed to store 2 weeks worth of her medication, and she actually took it in one go before my session. But I was working in a hospital then, so I could just go, okay, you need to go down to emergency right now because you just swallowed a very big amount of medication. It's potentially dangerous. You need to get checked out. So, I mean, other things would be like, of course, if they have attempted suicide or they are thinking of it, I would tell parents, all the safety precautions. The psychiatrist would tell the parents the same thing, like, keep all your window grills locked, keep the keys away, obviously, keep all the medications away, so only the parent will administer to the child don't take themselves.
Okay.
And then sometimes parents will remove the locks on the child's door, so the child can't lock themselves in.
But then these will all be symptomatic. How do they get to, how do you even reach that person inside, when somebody has reached that phase of actually wanting to kill themselves? Can we still reach them and talk sense?
Usually if they really, really want to do something to themselves, unfortunately, they will need psychiatric evaluation.
Right.
So a lot of them may need a period of admission, to one of the hospitals in Singapore, for stabilization first.
Okay.
Right. Maybe higher dose of medication, for example. Right. Because psychotherapy doesn't actually work when a person is that low.
I
see. You do need to be at a level where you're functioning enough where, whatever we're talking about in therapy actually just go in. So sometimes if they're really suicidal in session, for example, then it's not therapy for us, it's more crisis management.
Okay.
So we have to kind of gather who, where do you need to go, tell parents what you need to do.
That's actually good to know because, I do know of people where the kids have attempted suicide a few times, but I think parents they're also in denial. They don't really want to.
Oh yeah, keeping sharp objects away was the other one.
Oh yeah.
But yeah,
parents don't really want to admit the kid to hospital or because seeing psychiatrists is always a stigma,
Yes,
and they always say she's not mad, she's just going through a phase. But you think that by the time there is a serious attempt on life, actually the best thing is to admission and
I mean,
to
get help, some kind of help, right? Yeah, because
And
I mean, what is the
medication,
alternative if you know your child continues down that path? You know,
Okay.
if the parent continues to be in denial, you may well end up with a dead child.
Yeah.
And then you cannot do anything about it already.
But you know, the most common questions they will ask is, are they going to be with a psychiatrist forever? Are they going to be on medication forever? What are their chances of recovery? Yeah.
I mean, there are many factors that come into play in recovery, right?
Yeah.
So as much as the child wants to recover, medication, therapy and things like that, I always say if you don't have a good support system outside of it, you know, whatever we cover in therapy, even we see you like once a week, you know, 1 hour out of 7 days a week, you know, if the family system is unable to support what we do in therapy or make, you know, changes to facilitate recovery, then the child doesn't have a chance to recover.
I see.
Because unfortunately what happens is if the child is depressed or anxious, for example, or they're suicidal, their behavior, whatever's happening at home, unfortunately does support this behavior. Because this behavior has been allowed to happen. Right? So if you don't do something to the family environment or family system at home to support a change of behavior, the child's not going to change.
Yeah, that's true. So, you know, it has to be multifactorial. They have to see a psychiatrist that maybe can, you know, oversee their medication, see somebody like you who probably can counsel them. But as you say, it's just 1 hour a week. So at home, what should the parents do to actually support this recovery? Should they, you know, like one question I have is, should they even talk about it or should they pretend like everything is normal? You know, like, like should we even, there's a white elephant in the room.
I mean, I would tell parents to be vigilant but not be overly vigilant. Right? So some parents can kind of go the other extreme of are you okay? You know, you check in constantly.
You don't
so
want
it's
to treat them like a very
intrusive.
sick
Correct. Then the
treat
kids
them
like
a mad person.
Cannot, they make me want to do it again. But then it's just, you know, making sure like, can I bring you to school today? Can I send you to school? So it's almost like there is some time together, but at the same time, you also kind of ensure their safety because they can do something to themselves on the way to school if they go alone, right? But if you send them to school, you're keeping them safe also. Then you can pick them up from school, for example.
Then open up some communication.
Correct. And then, you know, just allowing yourself to listen to them. So sometimes I tell parents like teenagers and children, they actually function a bit differently. Children, when they come to you, is they got a problem. So you need to problem solve. But teenagers, when they come to you, it's actually different. A lot of the time, they want you to listen, but they don't want you to problem solve.
Oh, right.
But because we are so used to bringing up children, because first like 11, 12 years, right? We are in problem solving mode. So when a kid comes to us, automatically we jump to problem solving mode.
Yeah, that's absolutely true. Because when my daughter comes to me, my first thing is how to solve her issues.
Correct.
But you're right, maybe...
But sometimes she goes, "Aiya, mommy, you're not listening to me." Then you're like, huh? What did I just do? But actually, because they just wanted you to listen. So I tell parents, you just ask the kid a question when they come to you. After they tell you finish, you ask them, before you say anything, is this something you want me to listen to you? Or is this a problem you want me to solve?
And
then it mitigates a lot of problems along the line.
Yeah, I actually never thought of asking that of my child, you know? Because we react.
It's so automatic, That's why I say respond, not react, right? So this, what the child tells you, can guide your response.
I see. Because, you know, just the other day, my son was telling me, oh, he's so tired. And straight away, I probably jumped into reaction like, oh, you're so tired. What do you have a warm bath now and then go to sleep by this time and then tomorrow I will wake you up. So I just gave him a whole series of things he should do and I should do. Whereas maybe he wanted to tell me something.
Was there something you wanted to tell me?
Yeah, okay.
Why so tired? What happened?
Yeah, like the whys. So is there a guide for parents, like when the kids tell us something that, you know, some tips that you can give us so that it stops us from jumping into this reaction mode all the time?
Okay, so number one, I tell parents, don't ask why.
Don't ask why.
Don't ask why.
Okay.
Because it's a very difficult question to answer. So like say for example, if your child's upset. I mean, we've seen a lot, right? The very automatic, why you upset?
Okay.
When the kid is really upset, when we are really upset, you know, honestly, if someone can't ask you, hey, why you sad? You really cannot answer. You're like, go away. Right? So it's the same for them because their brains are less developed than ours, right? So their faculties are obviously and capacity is lower. So they won't be able to tell you why they're upset. So I tell parents, instead of why, you use how come.
Okay.
Same. It's actually the same. How come and why is actually the same. But it goes in easier. They can tell you. Or you ask the more straightforward ones, what happened?
Okay.
Ah,
Yeah.
Is there anything you need? What can I do?
That's interesting. Is there anything you need and what can I do? Are probably things parents least ask. It's always why.
Correct.
Yeah.
Because they problem solving mode, man. They
Yeah.
want to find out what's happening.
Yeah.
Then I help you, kind of thing.
Yeah,
Why?
yeah.
Oh, your friend beat you. Okay, tomorrow I go to school, whatever. But it's like, but maybe the kid's like, no, don't go to school. Social suicide cannot.
Yeah.
But we jump to problem solving so quickly. Right? So sometimes I tell parents, I mean, when I work with parents with eating disorders, we have this they call it like a acronym. Right, it came from I think Professor Janet Treasure. So she wrote this manual and treatment for caregivers for eating disorders.
Yes.
So she has this ALVSP.
ALVSP.
Yeah.
Okay?
So A stands for acknowledge. So acknowledge the feeling, right? Then L is label the feeling.
This is working for eating disorders.
Anything.
Okay.
Anything. So communication also.
Okay.
Acknowledge,
Label
the feeling,
Okay.
validate their experience. Because sometimes, as parents, we can
Like it's
sometimes
normal and it's okay that you feel this way.
Yes, correct. But some parents, when they invalidate the child, it'll be like, what's the big deal? We'll suck it up. Or I went through this in my time. I was
I think I was guilty. I was so guilty.
You got like that, Or it's like, you got all these things. How come you got problem now? So I give you everything.
Okay.
Yeah, so parents can invalidate their children unknowingly.
Okay, so validate. ALV.
Then fourth one is soothe. So soothe is like, sitting with them, maybe giving them a snack, giving them a hug, or, just allowing them to vent.
Okay.
Right? So this, and then the last one is optional. P is problem solving.
Okay. So that the problem solving is the least important.
Least is the last one. So that's why I tell parents, if you don't do the first 4 steps and then you jump straight to P, right, the kid's going to shut down and tell you you're not listening to me.
Yes.
But the child wants to feel heard first. The teenager wants to feel heard first. So you do have to go through A, L, V, and S first.
Yeah.
Then only when the child's a little bit calmer, then you can go to problem solving. That's why I say problem solving is optional.
I mean, I learned so much because you're right. Sometimes when my kid tells me stuff, the first thing I do is compare to my time when I was younger. And I think I probably don't even remember it. I would be like, my old days, nobody, we studied and that was normal. How come you cannot handle it? Yeah.
Yeah. But their reply to you will probably be like, but your time last time different.
Yeah, but it shuts down communication, right?
Correct.
Yeah. One thing one of my patients always ask me is this a phase that my kids go through, being depressed, a bit of suicidal ideation? Will they grow out of it?
I mean, some do, but do you want to take that chance?
Yeah.
Right?
Because we know that sometimes with some learning disabilities, they actually do improve with age. And, sometimes they just want to adopt a certain way because they don't want to, the stigma to label your child as suicidal. So, they want to keep it under wraps. They don't want people to know. And they say, maybe they'll grow up.
But actually nowadays, I find that the youth, they are actually more, they're quite strong advocates for their own mental health.
Oh, good.
Yeah, so compared to our parents' time, I would say, I think there's one benefit of social media is that it has really made teenagers strong advocates for their own mental health. It's like to them, they have learned that mental health is important. It's just as important as my physical health. So which is why we actually see quite a number of cases where, the child is actually telling the parent, I need help.
Okay.
Can you please go and find me a psychologist to see?
Okay.
Or they'll go to the school counselors, for example, and then, and then school counselors get inundated because it's one school counselor for the entire school. So, and they cannot see the very severe cases because it's not fair for them to see the more difficult cases because that's for more, tertiary level care. Yeah. So then, then they will come. So then now they are the ones who are actually kind of pushing for their own
empowered.
Yes, correct.
Okay. Because now previously we've been talking through the eyes of parents. So, let's talk about teenagers. If we were teenagers having some mental health issues, what avenues can we go to seek help? Is there a forum online that I can go to? Is there an app I can download if I was a teenager and I had a bit of suicidal ideation?
Forums not moderated. So
there's a danger.
There's a danger that the information they get might not be accurate.
Okay.
So I always tell teenagers, even in session, if you have questions and things like that, and you're not very sure, internet is not always the best place to look for the answers. Yeah. Even though there's a wealth of information out there, not everything is accurate. Okay. Right? So I remember one case where there was this boy, I think he was about 16, and then he came to a session, he sat down, he looked really, really sheepish, and then he said, I have something to ask you. You said I can ask you anything, right? So I said, yeah. what do you want to ask? Then he was like, don't want to say, don't say. Then I'm like, is it about sex? He goes, how do you know?
Okay.
Then I'm like, yeah.
Okay.
Then he was like, okay. Then I'm like, yeah, ask like, what do you want to know?
Yeah.
Yeah, so it's like asking the correct avenues.
I see.
Yeah, so parents, teachers, friends not always lah.
Yeah.
Known, as in adults who have the knowledge. You know, doctors,
Okay.
psychologists, you know,
Yeah.
dietitians for diet and nutrition and things
Yeah,
like that.
yeah.
Yeah, must find the correct sources for the answer.
I see. So you will find that what you're saying is if there are teens out there, they are not feeling their best, you know, and maybe they start having symptoms of low mood, then they should seek out people like you. And it's okay for them to come alone without their parents and speak to a professional like you.
Usually, if they're a little bit younger, we have to inform parents anyway because they're minors.
So maybe they have to go to their parents and tell their
Yeah.
parents that
Yeah.
that's the way they're
Yeah.
feeling.
But I do remember a case where she was telling me her friend, you know, clearly had symptoms of low mood, but then her parents just would not bring her to see someone.
Yes.
So then this client of mine felt very, very trapped because she's like, I don't know how else to support her anymore.
Yeah. So
I can
how
tell it's
in
not
those cases,
your, I mean, you've already done your due diligence. You informed her mother, you told the teacher, you told the school counselor, you brought her to see the school counselor. You know, that's as far as you can go lah.
Okay.
You know, you can be there for her, right? But my client was also in recovery. So I said, you also need to have your own boundaries, right? So if your friend's difficulties are kind of triggering your own relapse, then you might have to take a step back also.
Okay. But what if the parents are the source of the issues, you know, like maybe divorces or having a mother that's overbearing or a father that has such high expectations. So the parents are the source of their problems. Then in those cases, how are they going to seek help?
At some point, the parents are also going to think that, you know, the child has a problem, their grades are dropping, you know, something like that. So they might come in for another issue. But then when you dig a little bit deeper, so these are all the family issues. Okay, so the child might see me for individual therapy, for example. But then when I talk to the parents, I usually sometimes have parent-only session without the child. Then we'll explore a little bit more about the issues. You know, I will maybe explore a little bit about family of origin, you know, how they come to have their beliefs and expectations of the child.
Yes.
And then if that is not working well for the family, sometimes I recommend that they seek help of their own also.
Right. So actually counsel the parents.
Yes.
Yeah. Because if that's the source of the problem.
Correct. Because like I said, right, the family environment needs to change to affect change in the child.
But how open are parents to actually, you know, to acknowledge that I'm the problem, you know?
I usually will never frame it that way. I mean, if parents may contribute to the problem, but parents usually are also the key to the solution. They are part of the solution.
Okay.
Right? So I will frame it to parents that way, right? How you take care of yourself, right? How you manage your feelings, how you manage your emotional attunement, for example, also informs how your child sees the world.
Right.
Because as a teenager, you know, parents may think that they're not a big part of the child's world anymore, but to a teenager, their parents are still really important.
Yes.
It's just that friends are also important lah.
Yeah, that's true.
But parents are also very, very important because, you know, research has shown that teenagers will still go to their parents for the big decisions like subject combination or go to what school or I need money. Sort of thing.
So you're saying that if the parents cannot manage their own emotions, they're always reacting or flaring up or shouting, then it'd be very hard for these teens to have a proper role model.
And be able to manage your own emotions.
Yeah.
Because they don't learn how to manage. I mean, children learn how to manage their emotions from their parents, right? If the teenager never had that experience from their parents, means actually the teenager is also crippled in how they manage emotions.
Okay.
So therapy helps them to learn how to manage emotions adequately, but parents also need to learn how to do that.
True. But how important is friends in teenage years?
Vital, very
vital,
crucial,
right?
So, you need to find good friends.
Yeah, but in this day and age, I don't think you can choose your friends as much, isn't it? Isn't that more shaped by your environment? Or sometimes people don't even meet real life friends. Like you said, a lot of people just meet people online and we have no idea who or what they're meeting.
So online friends, I mean, if you do get along with this person, you know, it's fine. With teenagers, I always tell them to be very cautious when you're meeting your online friends because you really don't know who they are. They might turn out to be someone else. But in terms of like, you know, friends in your environment, your school, your neighbors and things like that, you are able to discern who they are as a person.
Okay.
Right? And, you know, some teenagers come to me and they have this idea that, okay, if I have this friend for now, they have to stay with me for the next 4 years, for example.
Yeah.
But I don't know. That's not what it is, right? As a teenager, it's like changing clothes, right? You're going to change clothes. And just like you will change friends because you are finding your tribe, as I call it.
Yeah.
The ones who get you, the ones that you can relate to, the ones that you feel comfortable and supported with. Those are the ones that you want to be friends with.
Okay.
Those who are, competitive, those who pull you down, those who make you feel bad about yourselves, I will tell them, why are you friends with these people?
Right.
Right?
Yeah.
They're not helpful in your journey to recovery. They're not helpful in
So
your
they have
life.
to recognize the good and the bad and make the decisions for themselves. Yeah.
Correct.
And then trust. And we as parents also need to trust them to make these decisions for themselves. Yeah.
Correct. But it's helpful for us to know who their friends are. So as parents, so that like I said, sometimes friends are the ones who will inform the parents. So if you know who your child's friends are, then this one can one, this one can one, this one cannot. Then you can slowly guide your child towards like, okay, a friend is someone who does these people fit the bill, But then these ones, maybe a little bit iffy, so maybe you want to stay away a little bit from them. Yeah.
So what do you think of the opposite sex relationships? Some parents tell me they don't let the kids have a boyfriend or girlfriend, but it's bound to happen and they are dating much younger. Is this a stressor or it's not really?
Not as much, I think, actually,
so
in clinic.
Can this actually provide support, having...
It can.
Until the breakup happens.
Yeah. until the breakup happens. I do have had cases where they have found solace in their partners.
Okay, so it's not all bad, right?
It's not all bad. But then there's always limits because the partner's also a teenager themselves.
Yes.
So there's a limit to how much they can support the teenager, for example. So, I've had cases where they are self-harming really badly or they're very, very suicidal. And then the boyfriend also don't know what to do.
Yeah, okay.
Yeah. So then, not that the boyfriend will tell us, but then the client will tell us, oh, my boyfriend also he don't know what to say.
Yeah, because they are so,
Correct, because they are teenagers themselves, right? They are young people also. They are not professionals, they are not grown-ups.
Yeah.
Yeah, they don't know what to do.
So for these teenagers that have all these issues, do you see them when they become young adults? Do they bring these problems into adulthood?
It depends. It depends. If they are able to sort of like take on what we sort of go through in therapy well, and if they have a supportive social network, the outcomes are definitely a lot better compared to those where the social network is the social support is not so strong.
Yeah.
Or they keep kind of having ongoing problems or ongoing triggers. So those ones, yes, I would say those tend to continue into young adulthood.
Yes.
So those who need more long-term.
And one interesting point you brought up was that, some of these depression, anxiety, they are hereditary. So if they don't treat themselves and then they have kids in the future, I wonder if it's hereditary as in genetic or hereditary as in because of
they see the behaviors.
Yeah, it's a learned behavior because children are so influenced by how adults behave. So creating an environment where your children in the future will also have the same issues. Yeah.
So it's a bit of both. So sometimes I'll tell my kids to look a little bit into the future. Like, next time you say your mother do this and then you don't like it, right? So if say next time you want to have kids and then like maybe 60% will go, they'll cringe.
Yeah.
Because they're like, I'm like, I know you're not thinking about it now because you're only like 15, right? But it might happen, right? And you don't want to kind of continue the cycle, right, with your children. So, or even your siblings, your younger siblings, for example, right? You don't want to continue that cycle. So, work really hard on yourselves.
I see. So you are really here to empower them to have insight into their condition and then to break whatever cycle they are in.
Yeah, and to empower them with skills, right? I always tell them, I don't help you solve your problems.
Okay.
Right, because that's not my job. My job is to give you skills to solve your own problems.
Okay.
Because next time when you don't see me anymore, you still have the skills. But if I'm solving a problem for you, next time when you don't see me anymore, you got the same problem, then die lah.
So what is like one session with you like? Is it an hour, 2 hours?
1 hour.
And how often do the teenagers have to see you?
depends on the severity, but
Okay.
typically I think for best outcomes, probably maybe weekly or fortnightly.
Okay. And they are very happy to sit there and chat with you, or
Yeah.
okay.
Yeah.
And do you have to use some things like, I don't know, meditation, music therapy, art therapy to get them to come out?
I do remember a case where this teenager was very reluctant to talk. So school refusal, low mood. And then I happened to have a sand tray in my room. So it was used by another therapist. And then I just opened the sand tray and then I told the teenager, okay, you just sit here. I'm going to sit next to you. And then I gave this teen a box of some manipulatives lah. So I said, then just do what you want.
Okay.
So literally, it had been maybe half an hour. The teenager hadn't started talking, right? I wasn't particularly nervous because I know that sometimes it's a first session and then they are very slow to warm, then why would they share all their problems with a stranger, right? So then the teenager started to just like touch the sand, swirl, dig hands in and all that. Then after a while, the teenagers like go, my girlfriend on Discord, I'm like, oh, okay, talking already? Okay.
Okay. Yeah. So because I think teenagers find it easier to talk to a third party than a parent. So when parents start to see these signs and symptoms, would you think it's a good suggestion for them to
come see me?
Yes, get the teenagers to talk to someone else. Because if the teenagers don't talk to me, then maybe they should.
So some parents will tell me, it's okay they don't talk to me. I will appreciate if they can't talk to me. But if they don't come to me, at least they got someone they can
an outlet,
they can
right?
talk
And
to.
safe and everything.
Yeah.
So if there are like 3 tips you can give to like parents on how to manage teenagers that may have some mental wellness issues, what would it be?
Okay, so usually I tell parents collaborative discussions.
Okay.
So like, with house rules or boundaries and expectations, set it together with the teenager, right? Because they're not children anymore.
So you cannot be a dictator.
Yes, correct. Don't be a dictator because they're not going to listen to you.
Okay.
Okay, so usually I tell parents have some boundaries and expectations around schoolwork, right? The expectations, you go to school, you get homework done, okay, revision, if sleep, meals, exercise, like these few ones, you need to have structure and boundary there. Like these needs to be, it's not a non-negotiable.
Okay.
Right? Some of my teenagers will tell me, Sook Fern, sleep is for the weak. And I go, no, sleep is not for weak. Sleep, you need sleep, otherwise you will not grow. So, and then provide structure and support at home for longer than you think they need. So a lot of times when teenagers start secondary school, I find that quite a number of parents think, okay, can I let go already? Because they being already. But actually, they're 13 years old only. And they're still 12, some of them. They actually still do need that level of support that you need to provide them as they were a child. So once you are confident that they have the ability to manage themselves, then you slowly let go. You don't let go and then throw them into the deep end. And then after that, when the child is struggling, you get mad that they're not managing themselves well. But actually, they needed support still. Active listening, so respond, not react.
Okay.
So that's very important. And I would say one of the tips is actually knowing who their teens' friends are.
Okay.
For that reasons I mentioned just now.
Okay. Well, it's been a great session. Thank you so much for coming.
Thank you. Thank you for having me.
Thank you for joining us for today's episode, Inside the Minds of Today's Teens, What They're Not Telling You. A special thanks to Sook Fern for sharing her expertise and heartfelt stories about working with young people facing some of life's toughest battles. If this conversation resonated with you or opened your eyes to what today's teens might be going through, please like, subscribe, and share this episode. You never know whose life you could impact just by spreading awareness. And remember, if you or someone you care about is struggling, reach out. Help is always available. Together, we can build a more compassionate and supportive world for the next generation. I'm Dr. Chai Ling, and I'll see you next time. Until then, stay curious, stay compassionate, and take care.